you need to change the posture, which gets into the second point, or the second factor that affects neck pain, back pain, and headaches, would be just function of the spine. That is, of course, the function of the joints, how stiff and restricted they are, also the strength of the spine, and also the flexibility of all the joints. But if you're working on the function of the spine, which is of course working on the joints and freeing up restrictions, but also working on the flexibility of the spine, including the strength of the muscles that help to maintain proper posture, that's important. Well, you need to change the posture. We use the acronym EAT: exercise, adjust, and traction. So we place certain bits of traction or stretching in certain portions of the spine that need it, whether that's scoliosis and you have an abnormal curve in your thoracic or your lumbar spine, or whether that is in the cervical spine where you have a lack of curve. You can do specific stretches based off your spinal presentation to improve the spinal condition. So you'd like to strengthen the spine. So in our acronym, again, EAT: exercise, adjust, and traction, we exercise the spine, we exercise the weak muscles. That could be in the cervical spine, exercising the muscles in the back of course, the cervical spine that actually retract the head back, but also the shoulders, how they bring the shoulder blades back, the scapulas, retract those. In the lumbar spine, making sure that your core and abdominal muscles are strong. So it's important when we're dealing with posture, we also want to look at function as well, the function of the spine. And that comes with adjustments, exercise, adjustments, and traction. That acronym really works, does wonderful in terms of addressing truly the root cause of spinal dysfunction and musculoskeletal type pain. So it's important to get to the root cause, and looking at the posture and the function is important.